The county has a total of 4 dental options: United Healthcare, Delta Dental Standard, Delta Dental Core, and Delta Dental Buy-Up Plan. Let's take a deeper look into each plan. United Healthcare Dental is Managed Care HMO plan, which requires participants to select a primary dentist. There is no maximum benefit on this plan, which means the plan will continue to pay its agreed-upon share regardless of how much you use the plan. Each service has a flat dollar amount copay, and it includes adult orthodontia. There is a very limited number of providers, however, in this network, and many of them are not accepting new patients. So before enrolling in this plan, please reach out to the provider you are thinking of choosing to ensure they are accepting new patients. Delta Dental Standard Plan is a preferred provider plan, also referred to as a PPO. It does not require participants to select a primary dentist. This plan's payment structure is percentage-based. Most services are covered at 80%, leaving only 20% of the service cost to be paid by the participant. This plan has a calendar year maximum of $3,000. Once the plan has paid $3,000 for a participant in a calendar year, the member is responsible for 100% of cost of services for the remainder of that year. Delta Dental has a large network of dentists to choose from. On the Delta Dental Standard Plan, orthodontia for children under 18 is covered at 50% of cost with a maximum lifetime benefit of $1,200. The other 2 dental plans available are the Delta Dental Core and Buy-Up. These are both PPO plans like the Delta Dental Standard Plan. The Core plan is slightly less in premiums. It does not have orthodontia coverage for anyone enrolled. However, it does include dental implants at 50% of the cost. The Buy-Up plan costs slightly more than the Standard plan in premiums. It includes orthodontia coverage for all participants, regardless of age, as well as implants at 50% of cost. Please be aware that Delta Dental plans do not have ID cards. Providers are able to gather your plan's benefits by your Social Security number. VSP is the county's vision care vendor for 2 plan options, Standard and Buy-Up. The Standard plan allows for 1 eye exam every 12 months for a $10 copayment. And it gives participants a $150 allowance for frames or contacts every rolling 24 months. You can receive up to $170 on featured brand name frames offered through VSP. The VSP Buy-Up plan is slightly higher in premiums compared to the Standard plan because it includes the following: a $200 frame or contact allowance instead of $150, every rolling 12 months instead of 24 months. In addition, you can use the $200 allowance to purchase non-prescription sunglasses from a VSP provider if you desire. This works especially well for those members of your family that do not need prescription glasses.